what the fuck is going on? It's kind of also like you don't want to look away because you're like, oh my God, what's gonna happen? Like, how did this happen? A TikTok doctor had her medical license suspended for alleged botched surgeries, live streaming procedures on TikTok, potentially without patient permission, and telling those patients not to call 911 if they had medical complications. Yeah. Dr. Roxy, also known as Dr. Gra, is a plastic surgeon from Ohio. Was a plastic surgeon? Oh, was a plastic surgeon. She had 850,000 followers on TikTok and I think 130-something thousand on Instagram. And although she grew up in San Diego, California, she went to medical school in 2005 when she became a doctor. And just because you're a doctor doesn't mean that you're a plastic surgeon or that you have specialized in anything. So she went through what appears to be an extra 5 years of training to become a plastic surgeon. And she's actually been a plastic surgeon and operated her own clinic called the Roxy Clinic, where people could get a Foxy Roxy body, which she's done for the past 13 years. Well, TikTok has not been around for 13 years, but it has been around for a little bit more than 3. And apparently, ever since 2020, Dr. Roxy has not only been posting online, but actually getting in trouble for it. And although everyone's reporting on this as like a TikTok surgery disaster, there's a lot more underneath the surface. And we're not just talking about the surface of the skin. Now, when anyone has been in practice for 13 years, there's bound to be complications, right? Human bodies are complex, but the complications here have gotten real bad. And the alleged potential cover-ups and the potential lack of post-procedure or after-procedure care that patients have allegedly not been given, it's led to 3 lawsuits this winter alone. And yes, she did just get her MD or her medical license revoked. Now, when it comes to TikTok, a lot of doctors and dermatologists and estheticians and care providers are using social media almost as a resume. There's some very interesting data on how social media is the new resume. Social media is an intrinsic part of our life. And for some people who are offering services like Dr. Roxy and her plastic surgery, they're using social media as a marketing platform to get people into their offices and booking treatments. And while that is not nefarious or bad per se, when it gets out of hand or when the social media becomes more of a priority than the surgery or the patient, that is a problem. But she really had the social media following where, yes, she would advise on things like plastic surgery, but a lot of times she was promoting plastic surgery unnecessarily, such as doing this pencil test with the cleavages. And I will actually link to this in the description if you want to see it. This pencil test, I don't know if it's something she created or not, but she was basically telling women, if you don't pass this test with a pencil, you have to come get plastic surgery, which is not an ethical way to do marketing in my personal opinion. But it's not just my opinion here, because apparently the medical board agreed. The state medical board suspended her license on November 18th, and they actually saw a lot of issues both with what she was posting on social media, as well as some of the botched surgeries and complaints that people were having. She claims that her approach to plastic surgery was different. She had an all-female staff, and she claimed that it was, quote, like a spa when people came to get things like a tummy tuck or a boob job, or even, yes, Brazilian butt lifts, which her clinic offered. But she also had a unique approach to her aftercare. She basically had like a Roxy clinic. She called her followers her Foxies, and people who would come get these procedures would actually stay in like a house or a location where they recovered. Think of like the Dr. Phil house, but for Brazilian butt lift recovery surgery. Now, some of the main issues were what actually happened in those recovery clinics or what didn't happen after those surgeries, and what was posted on social media, part of the time without permission or without even paying attention to what was going on. Now, please keep in mind that all of this is alleged. Everyone is innocent until proven guilty, but there seem to be some very interesting posts on both social media and some very interesting claims from a lawyer who is representing multiple people who claim they have been botched by Dr. Roxy. And there are some that are speaking up and posting on TikTok and vocal about it, and others that are staying silent. Essentially, multiple people started filing complaints from botched surgeries, infections, things not healing properly, having bad reactions and not getting discharge paper, or basically the what you're supposed to do after this treatment sort of papers that are medically required to provide. And some people were even told not to call 911. There was specifically this woman who posted her story on TikTok saying that she went to Dr. Roxy because she was so excited and found her on social media, but then her tummy tuck as a new mom was botched. And now she's having to have a corrected surgery, and it hurts for her to even stand. Another person had bowel perforation from liposuction, which is not only horrible and has the potential to cause major infection and complications. Yes, there's always risks when it comes to liposuction, but out of all of the procedures that plastic surgeons do, liposuction is known to be one of the safer ones. And the fact that liposuction actually put holes into someone's intestines, that's kind of hard to do, which we're gonna talk about exactly how that happens. But when when you look at some of these videos that were posted online of Dr. Roxy like not even paying attention to the camera, as a viewer of this who's just watching this objectively, and again, all of this is alleged until proven otherwise, when I just watch that, it gives me a very visceral reaction. And all of a sudden, it doesn't seem that far-fetched that this bowel perforation or holes in intestines where they shouldn't be could have happened. While all of this was happening, new people kept on coming in and booking appointments because of her TikToks, and she kept on posting and live streaming, and sometimes without consent, meaning the patients were unconscious or half conscious and not aware that this was being put on social media. And while Dr. Roxy did do a pretty good job of speaking about how much plastic surgeries cost and the differences in price, or speaking about before and afters, which most plastic surgeons do have a book of photos, a book of images of before and afters, you need to get patient consent. You need to get permission to share someone's body. And the fact that this allegedly did not happen is another huge concern that the medical board in Ohio actually started having issues with years ago. There are 3 pending lawsuits that we know about right now, and that's probably before many other people funnel in. Other than this botched tummy tuck, there was also one girl who had a BBL, a Brazilian butt lift. After this procedure, which a lot of plastic surgeons don't even offer to do because of how dangerous it is, by the way, she wasn't even given discharge papers, basically the things that tell you what to do when you go home. And especially with a BBL, you could have blood clots, you could have heart complications, you need to make sure that you're wearing very specific garments, icing, taking certain medications. If follow-up papers were really not provided, it's just like, what is going on here? And I guess that's the question that's actually being asked in this situation. Specifically, one of the most devastating is this girl speaking about the liposuction that she got from Dr. Roxy. You can see that that's her chin. It's just being stabbed at. And when it comes to liposuction, it can look aggressive to people who have never seen it before, but to actually stab through multiple layers of the skin and go past the fatty layer into the muscle and then into the intestine, that's just a big no-no. And the fact that Dr. Roxy has been licensed for 13 years makes me personally wonder if this is really true, how many other people have gone through this and had to stay silent because they were told not to call 911? How many other people had complications and didn't speak up about it? How many times has this happened? You see, this is a diagram of the skin, and while I normally use this to speak about the face because we have this big oil gland right here, this skin is also elsewhere on your body. And specifically when it comes to the skin, the model stops here at the hypodermis, aka this fatty adipose tissue layer. This is fat, and as you can see, it has little veins in it. Well, underneath the fat is muscle and fascia. That basically sits right here. And if you think about your tummy, flex your tummy a little bit, can you feel how like you can maybe feel your muscles underneath, but like there's this little bit of padding on top of it? That padding is this adipose or fatty layer of tissue right here. And then on top of that, you have things like the dermis, otherwise known as your skin, and the epidermis, the part of your skin that is constantly renewing and sloughing off. Because yes, your belly button creates dust. It collects lint, but it actually creates dust because dead skin cells are dust. Well, when it comes to liposuction, let's break down that word. Lipo meaning fat, and suction, think of like a vacuum or something that sucks or removes. And the way that liposuction is done is literally by taking a cannula, which is basically like a hollow stick, and putting it inside of the body. And you're actually sucking out this layer of adipose tissue or these fatty cells. Now think about when you do that. You kind of want to go at an angle that's close to the body. You want to get it into the skin, but you want to keep it relatively flat. If you stab, that's a no-no. If you stab, you could go through that muscle layer. You could go down even further into things like the stomach or the intestines. And that's apparently what happened. And although no plastic surgery is an uncomplicated procedure, liposuction is known to be done over and over again, and it's relatively safe considering everything else. Now, the fact that this person had bowel perforation or that their intestines were stabbed open, maybe the contents of the bowels or the contents of the intestines were leaking, maybe there was infection, even rhabdomyolysis, which one person was sent to the ER for, which is a breakdown of muscle tissue in the body due to trauma and infection. Like, oh my God, that's really, really f***ing bad and not very common. Like that's big damage and hard to do. And for most people, you kind of wonder, how was this possible? And when you look at some of the videos that were posted on social media and you see the doctor and the other staff like looking in other directions and just kind of going at it, it really makes you wonder how much attention was actually given to the patient, the person who was on the operating table. The state medical board specifically said that her social media posts were dangerous and she was paying more attention to the camera than her patients. And again, this was not the first time that she has been investigated. The medical board first sent Dr. Gra a warning back on October 9th of 2018. So this was even before TikTok. And they specifically stated that there was a quote, the need to maintain patient privacy when sharing photos or videos via social media. She also received a second warning back on September 28th of 2021, where the medical board expressed concerns about patient privacy and the ethics within her social media use. And Dr. Roxy didn't just get these papers and ignore it. As according to news publications, complications, she actually went to medical ethics training to understand what is and isn't ethical. It's kind of like if you get too many tickets, you have to go to driving school. Yeah, it's like that, but you have people's lives and their bodies and their personal consent in your hands. Some of the documentation cited, quote, avoidable complications, and these specifically meant that patients had to go get follow-up or correction surgeries based on Dr. Roxy's botched work. But even after Dr. Roxy was shown to have enrolled and taken these courses, specifically on professionalism, on medical ethics, and on some of the exact treatments that caused her patients to need follow-up surgery, they're saying that she still failed to protect her patients' privacy. Not only that, but in pre-operation interviews or in post-operation images of the patients from the operating room, she was still live streaming procedures and even interacting with live chatters while in the middle of a surgery. Now this is just absolutely unreal. So first off, whenever anyone is in the suite, whenever they are on the table and in the surgery room, you literally have what's called a sterile field. Things need to be sterile. If you are the surgeon, you literally have an assistant who hands you the tools. Are you capable of going over and grabbing the things that you need? Yeah. Does it happen? Sometimes, but you literally have a dedicated surgical assistant whose job is to stand there and just hand you the clean, sterile tools that you ask for and you need. And obviously, procedures that are slightly less invasive, such as liposuction versus open heart surgery, they are approached differently. But the entire reason for having a sterile field and for having an assistant is so that that surgeon is paying attention to the patient. And yes, there are times where medical students and researchers and observers are brought into the operating room to watch, but they are not to distract the surgeon. If you've ever been in one of the rooms and you've said something or done something to distract the surgeon, you get the stare of death. Like you will be burned alive by laser eyes. Like you don't fuck with it. And even if the surgeon is kind enough to have conversation or to do education during that time, most of the time their focus is still on the patient. Are we really surprised that this is happening? I'm surprised this is happening, but again, this is social media. Is this where we're at now? I guess so. I don't know. Now, Dr. Roxy did have until December 17th to request a hearing, basically to challenge this. And as stated by the lawyer who was representing the people who were allegedly botched by her, he was like, everyone's entitled to due process, which is so true. And if she thinks that she's innocent or that she didn't do any harm, she should say so. But the problem is that Dr. Roxy and her clinic have refused to comment. And again, when you just look at the social media, having only the public side of the story and some of the stories of what these women went through, being told, quote, not to call 911, it really makes you question. And a lot of people were wondering, why would this doctor allegedly tell her patients not to call 911? That doesn't make sense. Again, it doesn't. If there's a medical emergency, you should absolutely call 911. But this is also where legalities get very interesting, and doctors trying to hide certain things comes into play. You see, there are different types of surgeons. There are board-certified plastic surgeons, and then there are cosmetic plastic surgeons. Do you know what a cosmetic plastic surgeon is? It could be a dentist, all right? It could be any kind of doctor that says, I'm going into the plastic surgery field. A cosmetic plastic surgeon is not board certified. And while there are a couple of gems, a lot of them are a little scammy, to say the least. Now, cosmetic plastic surgeons also don't have hospital admission rights. Basically, if something goes wrong, can you get your patient admitted into the hospital? If you're a board certified plastic surgeon, the answer is yes. If you're a cosmetic surgeon, depends on the jurisdiction. I don't know every jurisdiction, but from my understanding, most of the time the answer is no. And if you're having a medical complication, you want to be able to be admitted to the hospital. Now here's the thing, Dr. Roxy was a board certified plastic surgeon. Why would she tell her patients not to call 911? Well, because if you have too many patients calling 911, what happens? You get your medical license revoked. If Dr. Roxy and her team were so concerned, or they knew that maybe they were stitching things up improperly or causing holes in people's intestines, instead of doing the right thing and saying, there's an issue here, this patient might need to go in for scans, this could be infected, they could get sepsis, aka bacteremia, literally bacteria presence in blood that should not be there. That is how you die very, very quickly. We don't want that, but we do want it in the ER because that is the best place for it to be taken care of ASAP. And the fact that Dr. Roxy or her team allegedly said, don't go to the ER, just stay here in our cute little Dr. Roxy Foxy recovery house, just makes you wonder, what were they trying to cover up? Why did they not want patients to seek proper medical care? And like, this is 101 of medical ethics. Like, the first thing you do is make sure that number one, you have consent. Number two, discharge forms. Let patients know what to do in case of a rare complication or side effect. And I mean, speaking of that, what is patient consent? It is literally making sure that a doctor or that a plastic surgery clinic has the right to ask for testimonials or before and after photos or to live stream your procedure in front of multiple other people. Especially with laws such as HIPAA, the Health Insurance Accountability and Portability Act of 1996. Yeah, that's the entire reason that I can't take YouTube into clinic and that I don't, is because you need patient consent, and I don't own my own clinic. Again, I'm not a doctor or dermatologist. I need not only patient consent, but the derm's consent, the owner of the clinic, anybody else who appears in that video. If there's like medical imagery on the wall, I don't know all of the copyright laws around medical imagery, because if it's for education, I think it's cleared, but like you might even need copyright permission for that. Medical consent is the #1 thing. Have you ever gone to the doctor's office and they're like, can we leave a message on your answering machine or on your voicemail? Like, that is literally them asking for consent, let alone to post you on their social media as a before and after picture. And the fact that some people are claiming that they didn't even know that they were being live streamed with their bodies out there, especially in plastic surgery where the bodies are usually unclothed and we're showing areolas and all sorts of stuff. Bro, ski, no. Now, if you are looking to learn about plastic surgery, different treatments and procedures, there are some really great places to look on social media. Some people do share their journeys. Some doctors and plastic surgeons and dermatologists do share information for the purpose of helping others. But there's a very big difference between properly educating and showing imagery from before a procedure happens and after a procedure happens versus live streaming during the middle of it. If you're looking for some plastic surgeons that actually educate and, you know, don't give people this pencil nipple test telling them that they need to go in for surgery, I would definitely recommend people like Dr. Kat Chang. She's amazing. There's also Dr. Greer. There's Dr. Anthony Yoon. There are a lot of really good plastic surgeons or dermatologists who are doctors first and social media people second. And especially when you're going in for a treatment or procedure, that's what you're looking for. Mistakes in these things are bound to happen, but here's what you need to know. The first is make sure that you're looking for multiple sources for your plastic surgeon. Look them up, not just on social media, but elsewhere online. Ask for testimonials from people. And if you do sit down with them, literally ask them what has gone wrong. If they are being honest with you, they will tell you that mistakes have happened. If they've said mistakes have never happened, run the other way. Don't walk, run. But an honest doctor should say, yes, mistakes have happened, and this is how I fixed it. Something has gone wrong, and these are the procedures and the steps that I took. And for you, any procedure does not come without risk. There is a risk-benefit analysis for literally everything. So they should inform you about what those risks and potential side effects are, even if they are very, very slim. And that is what an honest, good, trained medical professional should be doing for you. And then of course, if you have any concerns, if something goes wrong, you should report it. If you are having an emergency, hang up and dial 911. You are in your body 24/7. You know it pretty damn well. If something is off, you can feel it. Take care of it, because you never know if it's a medication side effect, if something went wrong during a surgery or procedure. Always get checked. It is better to be safe than sorry. What the fuck is going on? It's kind of also like you don't want to look away because you're like, oh my God, what's gonna happen? Like, how did this happen? What do you think? Stay hydrated. Reapply your sunscreen. The one that I'm wearing is literally tagged right here, along with the moisturizer that I've got on my face today. And I've linked some of the news articles and sources from this video down below, as well as some of the TikToks that people re-uploaded of Dr. Roxy, since it appears that Roxy's social media has just been wiped. Always remember to be beautiful, both inside and out. I love you, and I cannot wait to see you in this next video. Love you guys. Bye.